Walking, moving, going to work, out to a movie, out to dinner. For people with MS, simply moving from place to place can be a challenge, and people with MS face an increased risk when they take a walk, the risk of falling.
Sometimes you're walking along and you're perfectly fine, and all of a sudden, your right or left foot may drop. By drop, I mean you no longer have control over that foot, and you can trip right away.
I don't have great balance and coordination, so all these things together makes it difficult in crowded situations or in any kind of uneven terrain.
I have oscillopsia, which means the processing in my brain for my vision isn't fast enough. When I walk down the street, it's like watching a camera that's jiggling. Balance is a continuous issue for me.
Falls are very common for people with MS. In the research that we've done, we've focused on people 45 and over. In that group of people, half of them had had a fall in the past 6 months. Of those people, about a third of them are what we would consider recurrent fallers or multiple fallers. So it's a very common problem.
If you are a person with MS, preventing falls is a critical part of managing your disease. Falls are not just embarrassing or a nuisance. They can result in serious injuries. Learning how to minimize falls will improve your quality of life and your peace of mind. Renee Webb has experienced recurring falls as a result of her MS symptoms, but one fall in particular stands out.
I can remember we went to a blues festival in Monterey. I was with a group of friends, and I wanted to be the first one in the car. I opened a big car door, and the weight of the car door caused me to fall backwards, and I fell backwards, and my head just hit the ground. I just didn't want to make the other people have to wait for me, because they always have to wait for me.
If you have taken a fall as a result of your MS, you're not alone. Research shows that most people with MS will eventually experience a fall as a result of their symptoms. In one study, 54% of people with MS reported at least one fall in the previous 2 months, and 1/3 of those reported recurrent falls. In another study, 52% of people with MS aged 45 or older experienced at least one fall in the previous 6 months. And in yet another study, 64% of people with MS aged 55 or older reported at least 2 falls per year. So why are people with MS at a greater risk for falls than the general population?
People with MS are at risk for falls because MS lesions in the central nervous system can affect their vision, balance, and mobility. And problems in any of these areas can increase their risk for falls.
They may have weakness on one side or both sides of their body, and losing motor control and that kind of weakness impairs someone's ability to walk or reduces their balance and predisposes them to falling.
And we know that people with MS have changes in sensation. They have a sense of numbness, or they can't feel where their feet are. The other thing is what we call position in space or proprioception. So knowing that your arm is up or your leg is down, that is also something that can be influenced in MS.
If someone has blurred vision or double vision, blind spots, or they're not able to detect differences in contrast or color, that can make them more susceptible to falls because they may not see the difference between the curb and the pavement, or they may not be able to see the pillar that is just off to their side, or they may not be able to see the clutter that's on the floor, or a dog, or some obstacle. Spasticity is another MS symptom where people get muscle tightness, and if it affects their leg, then that tightness can impact their balance and mobility as well.
It could be strength, flexibility, motor control, by which I mean choosing the right muscle at the right time, the right amount. It could be a general balance issue. It could be their ability to integrate all their sensory input to maintain their balance.
Someone who has MS and suffers from fatigue can overexert themselves at times and may get fatigued from that. They may also have sort of cognitive fatigue, where if they've overdone it, they may not be able to remember that they should be watching where they're walking, or remembering to use more of a heel-toe technique when they're taking a step.
Medications taken to address the symptoms of MS can be very beneficial to the patient, but they can also be another factor that contributes to falls.
Patients may be on a medication for depression, which have been associated with falls or increased risk of falls. Other medications, anxiety medications, anti-seizure medications, whatever they happen to be on, there may be an effect on their balance or their ability to walk safely.
Darrin Jones' last fall occurred in his home and left him with a broken nose.
Typically, all of the falls that I had to happen in or around my home, because normally when I fall, I don't have my cane with me, just because I'm more comfortable at home. My most recent fall, I don't normally wear slippers at home, just because they slip. And I had on my slippers and walking across the floor, my right leg slipped, and I tried to balance myself out with my left leg, and it didn't work. I hit my left knee and went face first into the ground and fractured my nose. I stayed there a minute, after I calmed down. I got up on my knees, and then I crawled over to a wall, and I was able to stand up from there. And then I proceeded to the bathroom and clean my nose up.
Britta Schramm is a speech pathologist specializing in cognition. She is also a person with MS.
We live in an environment, you might have noticed, that car alarms go off and cell phones are always ringing and there's a lot of noise, and so our attention is easily diverted. We have to constantly take a check. Am I with what I'm doing? Am I focused? If you're not, you can trip, fall, because you're not really in the here and now. I use Scan and Plan as a safety device. I am scanning, I'm looking around to see where it is I'm going to be walking. I'm looking around to see what the entire environment is like. Is there a wall on my right? Is there a cord running across the front of my path? Is there a broom in the way on my left?
When you go downstairs, it is important to hold on to the handrail and carefully gauge the height and depth of the stairs using your eyes and your feet before you begin to go down. As you walk, make sure you know the true depth of each stair.
Now this set of stairs is different because it's rained and there are leaves, and those leaves look very slippery to me. So I'm going to make extra sure that I have a good hold on that banister. My foot's kind of testing the surface because there are things on the surface.
Escalators can be challenging. As the steps move, it may be difficult to judge when to step on and off. There may be a sensation of falling forward, which is why it is very important to hold firmly onto the handrail as you step on and off an escalator.
Patterns in the road can present a lot of problem because you almost become dizzy by the different colors and the different patterns. So what you have to do is you have to take a look at what you're going to walk over, so you are testing as you're going. Ramps have banisters, and the reason they have banisters, the heights change all the time, and you also have the colors changing. So the best thing to do on ramps is to hold onto that banister. It is so important to be able to give yourself a day plan. How are you feeling that morning? Maybe you're fatigued. So you have 7 things on your list of the things to do today. Let's prioritize. How are you going to make the most of your day? Your energy may not make it past lunch. If it doesn't, what can you do? So you have to have plan A, and then you have a fallback of plan B. One of the things I do is I always keep a cane in my car. I'm fine this morning. I can walk, I can go on a hike. By the afternoon, I may be dropping on the right side, both sides. Do the things that are the most important when you know you're going to have the energy. By the end of the day, you may need a little help or you may need to cancel.
Adapting your home for your MS is an important strategy for minimizing falls.
The first thing is just to look at some really simple things around your home. You know, if you go online and you put in home safety checklist, there's all sorts of really helpful resources on home safety.
For example, we always focus on scatter rugs. Do they have scatter rugs removed or in such a way that they're not as apt to trip on it? Do they have adequate lighting in all the rooms, especially when they're walking around at night? Because vision is a major reference point that we use for our balance.
We're required by our condo association to have 70% floor coverage with rugs, but the rugs are taped down at the corners and along the edges. So I've never taken a trip on our rugs because they're taped down.
We put a brace on our front door so we could step inside the house, two braces on the back porch because you step down and to grab on to make it more stable. And we have braces all around the toilet and shower. So I think what it is where you're going to be unbalanced is where you should put your braces.
I had one woman tell me about her pet that made her fall. She couldn't tell. The pet was small and sort of blended into the flooring, and she couldn't tell where the pet was. So recently she put on a brightly colored scarf on the pet so that could help her. She could also have put on like a little bell so she could hear her pet. Sometimes people have pathways if they want to get from their living room to the bathroom. Have that be a straight pathway with having furniture out of the way so that you can make a straight shot to the bathroom and not have to negotiate your way around furniture.
One of the things I see in patients with MS is they often can have a sense of urinary urgency. When they have to go, they have to go. And that actually puts patients at risks because they may get up in the middle of the night and paying attention to getting to the toilet right away rather than watching their foot placement or making sure they don't fall. There are medications that can reduce that sense of urgency and may help.
Another important strategy for minimizing falls is exercise. As our bodies get stronger, we may be able to better maintain our balance in challenging situations.
It's very important that people with MS exercise. It's important to combat symptoms such as fatigue, spasticity, weakness, muscular weakness, all which can contribute to falls.
Here at the center, once a week we have a workout program. And then on top of that, I try to go out at least twice a week to my gym with a friend of mine, and we work out a little bit.
I noticed now that I'm walking more, it's easier for me to get up from a fall. I have more strength in my muscles, and I think I have more confidence in myself.
If a person can enhance their body awareness during exercise and involve some of their sensory systems, such as proprioception, the vestibular system, or position of the head in space, and the visual system, they can promote enhanced balance and ability to maneuver in environments where there's maybe uneven terrain or they're getting pushed by someone walking in the street.
I actually have been through physical therapy, and that's really helped me a lot. So they show you the right way to fall and what exercise you can do to strengthen different muscles. So that's really a key. I think you need to talk to your physical therapist or your doctor to find out what you're able to do so you don't cause any more harm or any more problems.
I think having a piece of assistive equipment can make a dramatic difference in people's lives. It helps them get out in the community more. It helps them be safer even within their own home. So it can open up a number of different doors to them just in terms of getting out and shopping or doing some hobby that they used to enjoy in the past and they haven't been able to do. And there are those, they equate equipment with disability and they don't want to be viewed as being disabled. The other side of that, though, is that there are people who do use equipment who are probably enabled by the equipment. We know they are because they can walk further. They can participate in activities. They can go out with their family and do things rather than become isolated within their home.
Well, I was hesitant to use a walker. I didn't want to go out. I didn't want to be seen with a walker. But now it takes me out of the house. even though, you know, it might not be for a long distance or anything, but at least it gets me out of the house. You're safer if you need to use a cane or if you need to use a walker or even a wheelchair. I mean, it's safer than just, you know, pretending that you're going to be okay and not fall.
Yeah, when I recommend some kind of assistive device for gait in patients with MS, I make sure that they spend at least one session or perhaps more with a physical therapist or a therapist who understands the equipment and can help to make sure that it's the right piece of equipment, that it's being properly used, that it's the right height, and that the patient knows how to use it.